Hey guys, welcome back to Paige's Progress. Today I'm going to go into detail of how I got started to even get to my preoperative diet, and then go into how I'm doing 2 weeks post-op, which was Wednesday the 18th. Was it the 18th? I think it was 18th or 19th that I was 2 weeks post-op. Sorry, I forget. I think it was the 19th. First, when you start and you consult a bariatric surgeon, most surgeons will have you go through a list of other doctors that you must see to get cleared before you even get to the post-operative diet stage. Some of those testings include a sleep study, going to be cleared by a cardiologist, rounds of labs, and pretty much the sleep study is one and done. You either have sleep apnea or you don't. If you have respiratory issues, maybe seeing a pulmonologist would be part of your clearance, just to make sure that being intubated, being intubated for surgery is safe enough and you won't go into respiratory failure or have any other issues like that. The cardiologist is kind of hit or miss. I work for a cardiologist. I am a cardiology tech. So being that I see patients who are involved in cardiac clearance, there's a lot that goes involved into being cleared preoperatively for surgery. It starts by having an EKG done. If the EKG is normal and you don't have any family history, it's pretty safe to say that as long as you're low risk and don't have any risk factors, I'm not a cardiologist, this is just what I see in my patients at Lourdes, you're pretty much set on your way. You're cleared for surgery. As for me, I didn't have to do any of that. Like I said in my first video, I do have tachycardia. I do have strong family history of heart disease and other related risk factors, but I was severely cardiac worked up back in 2015, and me and my surgeon had discussed that since the outcome of that was just because I was heavy, all my issues, my tachycardia, the fast heart rate, that he wasn't going to waste my time with getting re-cleared, because it was already determined that due to my weight was because that's why everything was happening. So, needless to say, I started having my own issues, my own palpitations. I was just having symptoms again, and being that I'm a little psychotic and everyone's fear on the OR table is not waking up or dying on the table, I decided to get cleared anyway. So I had an EKG done that showed I was fine. I was hooked up to a Holter monitor, which for those who don't know what that is, it's an at-home monitor that you wear continuously. The ones nowadays that we use at our office is a patch. It goes right over the left side of your chest. You can shower with it. It's really great. You're not hooked up to 1007 leads with the big box you got to carry around on your hip. So that came back as I was showing no signs of tachycardia. So that was cleared, and then just to be safe, the cardiologist ordered an echo, which is an ultrasound of your heart, just to make sure everything's good. And like I said, I had that septal enlargement, so I was just curious to get that checked to see if that was progressing or if it was stable, and it actually was not found on the echo this time around. So I was cleared. I just had to get preoperative labs 2 weeks in that time frame, 2 weeks before surgery. So from the time I started my liquid diet, which was November 21st, to my surgery date, I had to get labs done. So the liquid diet. Now, mind you, this is my program. If you don't get operated on by my surgeon, then your preoperative diet is going to look different. Many people have said, wow, Paige, your preoperative diet's pretty easy. But let me put into perspective that we all overeat, and that's why we got to where we are, to the point where we surgically need help to get healthy. Yes, my preoperative diet may be easier than other programs, but it's definitely by far wasn't the easiest to start or overcome. It took me about 4 days to get used to what I was eating, what I would be eating for the next 2 weeks, and so on and so forth. So here is my liquid diet. It's probably going to be backwards, but mainly I had to start this 2 weeks before surgery. The purpose of this preoperative diet is to shrink the liver for safer surgery and mobilize fat storage for optimal weight loss after surgery. So it's no joke, and it's no surprise that many overweight people have fatty liver. That's the nature of it. It's just what happens. So this preoperative diet is to shrink your liver, just to make sure that during surgery, when they lift your liver up to access your full stomach, that they don't adhese your liver, they don't bruise your liver. It just makes for a safer operation. So my protein goals for the 2 weeks was 80 grams, and my fluid goals was 64 ounces. So the doctor recommended that I try and save the one meal I was allowed for when I was at work, which is smart. I work 11-hour, sometimes a little more, almost 11-hour days. And I just need to keep up my stamina. And this 2-week liquid diet, I can tell you I was consuming less than 1,000 calories a day, which when you go from eating, I don't know how much I was eating a day, to be honest. I never logged my food when I was eating unhealthy. That's not something you really keep track of. So I want to say I was probably taking in at least 2,500 calories a day, maybe more, depending on the day. So like I said, I became obsessed with Premier protein shakes. They, to me, are not chalky. They're not gritty. They go down fine. And they have about 30 grams of protein per shake. Now, with the given new lawsuit that they have, it's 27 grams that was to be found in these shakes. So even still, consuming 3 of them allowed me to hit my goal. So I drank 1 for breakfast, 1 for lunch, and 1 for dinner. I was also allowed to have crunchy foods, which included a cup measured of salad with light dressing once a day. I used that as my lunch. I loved drinking my protein shake. I took about 15 minutes to drink. It's 11 ounces. I let that take me about 15 minutes to get, decently full. And then the last half of my lunch, I ate my salad. I also was allowed to have 1 cup of crunchy raw vegetables daily. The recommended for me was celery, cucumbers, raw carrots, fresh broccoli. Carrots, I had an extremely, extremely hard time because I cannot eat them without them being dipped in ranch. Broccoli, too. I can eat cooked broccoli raw. I'm fine. Throw some salt and pepper on it. I'm good. But raw broccoli, I cannot eat that without it being dipped in ranch. I don't know. And I can't stand celery. Celery juice is absolutely disgusting. And so I stuck with cucumbers. I did try the carrots. I got about 4 carrots deep before I was like, I cannot stand the taste of it anymore. So I just stuck to the cucumbers. Fluid-wise, I was allowed to have non-caffeinated liquids as well as Crystal Light, decaf tea, chicken, vegetable, or beef broth, or vegetable soup without pasta. Now, this was huge because if you guys know anything about vegetables, some vegetables are very fibrous, which means they fill you. So along with dinner and my protein shake, I ate Progresso Garden vegetable soup. I threw a little bit of hot sauce in there, which I did stop a couple days before surgery because I did not want the lining of my stomach to be irritated. But for, I want to say, about 10 days, I was eating garden vegetable soup with hot sauce in it, which really made me happy. There was corn in there, green beans, tomatoes, carrots, little cubed potatoes. Yeah, it was really good. I was also allowed to have unlimited sugar-free popsicles, sugar-free water ice, because those counted as fluid intake as well. And the little bonus that I had on my liquid diet was I was allowed 1 cup of fresh fruit each day. I ate this when I was feeling hungry or I wanted something sweet. If anyone works in the medical field, they know around Thanksgiving and Christmas, that's the time of year the office gets flooded with, oh, here's Dunkin' Donuts for you. Here's, a pretzel tray for you. So I used that cup of fruit as kind of saving me from temptation at work. We also celebrate like National Cookie Day and stuff like that. My manager really, goes all out and makes sure we have fun in the office and get to celebrate, fun days like that. It's fun. So that was my pre-op diet. I followed that pretty strictly. I did have sushi a couple times. I'm not going to lie. I started the day before Thanksgiving, so my surgeon did say that I was allowed to have Thanksgiving dinner if I wanted. I was also allowed to have 1 small meal a day if I wanted. But I knew myself. I knew if I ate 1 small meal a day, that would open me up to wanting more food. And being the surgery I was getting where they were taking 80% of my stomach out, I knew that if I didn't cut my calories then and got used to it, being that I'm going to be taking in right after surgery less than 300 calories or less than 500 calories would be extremely mentally tough on me. So I just balls to the wall. I did not eat Thanksgiving dinner. I had my garden vegetable soup while everyone else was eating turkey, ham, green bean casserole, the 9. Biscuits, which are my freaking sweet spot. I love bread. I am a mess for bread and mashed potatoes. They are my absolute favorite. I don't think I'll ever get sick of them. So it was hard, but you get used to it. I'm making a life change, and that's the way I look at it. This is not a temporary thing for me. I've started thinking healthy way before I started this pre-op diet, so I wanted to maintain the mentality that I had and that kept me driving to, want to do this and everything. So the first couple days were rough. As I mentioned, I started the day before Thanksgiving. So I slammed my body with water. I was drinking over 100 ounces a day. If I was hungry, I chugged a half a bottle of water, which fills your stomach, makes you not full. So that was good for me. The first couple days you go through legit food withdrawal and sugar withdrawal because hardly anything I was eating had sugar in it besides the fruit, which honestly next to nothing. So this time of year, fruit is not as sweet as it is in the summer. So the watermelon I was eating wasn't too sweet. The cantaloupe I was eating wasn't too sweet. The green melons weren't sweet. The pineapple was pretty sweet, not going to lie. So that's where I got most of my sugar from. And my shakes have, only 1 gram of sugar, but that's allowed. So it was rough. You really start to realize how much food controlled your mood. you're happy when you eat certain things. When you don't eat certain things, you're miserable. Like, that's how I was. I was addicted to food, and you don't really realize stuff like that until you're put in a position where you have to get rid of it. I lost 14 pounds in 14 days, so that was a pound a day. I could have lost more, but when you're sitting at home not doing anything, your intake calorie to burning calorie ratio is smaller than when I was working, because I wasn't walking when I was home. I was sitting around not doing anything. So I could have lost more, but I was happy with it. 14 pounds in 2 weeks. I've never done that before a day in my life, and I was extremely happy about that fact. So I started that. I had my surgery day, and I got my pre-op blood work done, and I'm a weirdo, and the office was not calling me, so I had one of the girls at my work pull my labs, since I'm not allowed in my own chart. So I was looking, and I was like, all right, it was, just a CBC. That's all it's required, just to check the white blood cell count and all that other stuff. And I noticed it was marked high, and I'm like, where could I have an infection? Like, I'm so confused. So I went to urgent care. They treated me for an infection, and I called the office and I was concerned. I was like, why didn't you guys call me? Like, I'm a pre-op patient. I'm getting ready for surgery, and my white blood cell count is high. Like, why are you guys not concerned? So basically, if it doesn't have anything to do with your respiratory, your gastric system, or anything that they're going to be near during surgery, they're not concerned with. So it ended up being a urinary tract infection. So I got treated for that, and that's why they were not concerned. Made sense to me, but still kind of scared me, and I wanted to get it taken care of prior to surgery. So I went to my PCP. I redid the urinalysis, and he reordered my CBC for me because he knew that it was important for me to feel okay, that, okay, I took care of my problem, now I'm good. So the second CBC came back, and it was fine. So I felt, a little more at ease. So let's fast forward to December 5th. December 5th, I reported to Lourdes at 6:30 a.m. I was actually his second patient of that day. So we got there. I immediately knew when I woke up I could not pee. All women of childbearing ages before they go under surgery must take a pregnancy test. That was negative, of course, because I've had my surgery. So I was waiting in the waiting room for about an hour before they called me back to pre-op, and there I got changed into my gown, my hospital socks, and my little bonnet. Sorry I don't have any pictures of that. My mother-in-law and my mom do, but I was giving them the finger, so I don't even know if they're good pictures because I didn't want any pictures taken. I just wanted to be taken back into that OR. So the nurse comes, and anyone who knows me knows that I do not shut up. Once you get me going and talking, I don't stop. So very early in the morning, I was making everybody laugh. I was cracking a whole bunch of jokes. And the minute I walked back, I ended up seeing my cardiologist, the doctor that I work for, Dr. Jason Smith, and he's such a nice guy. He came back, he finished with his patient, and then he came and talked to me and said how excited he was for me, and he wishes me nothing but luck and to, get better soon so I can come back to the office. So that was really nice. And then he came around again when my mother-in-law, my mom, and my husband were back saying, their last, see you laters to me and whatnot. So we talked again for like another 10 minutes, which was really nice because I talk about all my doctors a lot because they're just so awesome. And it was nice for my family to, finally meet, one of my boys at work who I constantly talk about because he's just such an awesome doctor. So The lady tried both my arms to, well, tops of my hands to get IVs, but my veins in my hands blow so easy that I knew it wasn't going to work, but I know that's the most comfortable place when you're staying in a hospital for a couple days to have an IV. So I told her she could try. I didn't mind being stuck. I have 7, 8 tattoos, and I'm not afraid of needles, so I told her just to have a whack at it. So I blew both hand veins. She tried in my right arm, and there was nothing there. She knew there was a vein there, but my veins are deep, they roll, so I'm a really hard stick to start with. So she tried in my left arm. She successfully got it. And yeah, I was all done up. Anesthesiology came, and I always joke and call them my bartenders for the day because they're the ones mixing the cocktails. They're the ones making sure I'm asleep and I stay asleep. And I had my team huddle with them. I said, all right, guys, let's bring it in. One goal, and the only goal today, is to keep Paige asleep. That is the goal. So I had them laughing, and the nurses, a couple of them made a comment like, I've never seen anyone like in this seat been so excited. And I was like, girl, I've been waiting for this for 3 years. Like 3 years I've been waiting to have this surgery. So shortly after that, I cannot see without these things. I am like a straight 4 eyes, and for surgery they tell you not to put contacts in. So they were like, all right, well, take off your glasses now. And I'm like, but I can't see the OR. I was really upset that I couldn't take my glasses in because I wanted to see like the actual inside of an OR. Like, I'm a freak. Like, I love medical stuff. Like, I wanted to see where I was being operated on. So they wheeled me back. I saw some kinds of the OR. And I was placed on the table. They put a nice warm blanket over my legs, which felt really nice because that OR, I'm telling you, when I say it was probably 30 freaking degrees in there, it was cold as hell. Like, I was like, how do you guys work in this? Like, this is harassment. So they put a warm blanket over my legs, and then they strapped me in. And I kept telling them, like, guys, the only way you're going to be able to shut me up is putting that damn mask over my mouth. Like, and next thing you know, I'm waking up. I don't remember them putting the mask on my face. I don't remember them telling me to take deep breaths. I don't remember saying, all right, guys, I'm going to, push something through your IV. You're going to feel a little sleepy. None of that. They were slick. But hey, in an OR, that's the kind of the best way to be put out. Is when you don't know. Like, I was just casually talking, and next thing you know, I'm waking up. The first thing I remember when I woke up is I was like, oh my God, I'm going to spit. I need to spit. I need to spit. I think they had just taken the tube out from down my throat. So they let me spit, and then they started rolling me. And immediately I was in pain. I was moaning. I was in so much pain. They were then at that point placing my binder on me, which keeps you compact. It actually feels really good. I kept that on for 3 days straight. Whenever I took it off, I kind of just felt like my insides were going to pop out. But then I remembered, Paige, you just had surgery. They had to move some things around in there to, get to your stomach. So I had to let everything kind of settle back into its place. So I wore that for the first 3 days, and it felt really good. So I went into it being a big, tough, bad girl. I'm not going to use pain meds. I'll just use Tylenol. I was so freaking wrong. I immediately, like I said, when I woke up, I was in so much pain. I was moaning. I was groaning. I was just super, super, super uncomfortable. But they do pump you with a lot of gas during laparoscopic surgery. So that is why I think I was in pain. Now, I've only had my tonsils taken out 18 years ago. So I couldn't tell the difference between surgical pain and the actual gas pain. The doctors are telling me it was gas pain, but I was being treated postoperatively with pain with Dilaudid through my IV every 4 hours, and that helped. So I know gas pain is not relieved by pain meds. I don't know if it just knocked me out so I wasn't feeling the pain. But needless to say, once I got to the PACU, that was honestly one of the first things I asked for because I was just so freaking uncomfortable. It was bad. Like, I've never been in pain like that in my life. I'm not a sick person. I'm not really ever in a whole lot of pain. So it was really weird for me. And I ended up being in the PACU for 7.5 hours. So the PACU was the post-anesthesia recovery unit. And it's just really busy down there. It's everyone coming out of procedures, waking up, and just vitals are being monitored. So you can't really walk around down there. They weren't letting me walk. And anyone who's going through this journey, your surgeon and your nutritionist right off the bat will tell you walking is the most single-handedly important thing once you get out of surgery. It gets that gas moving, it dissipates it. This is gas that I have been told by my surgeon. You cannot burp out, you don't fart out. I didn't burp or fart while I was in the hospital. The gas just kind of dissipated. The more I walked and the more I was active, my body just absorbed the gas. So I was down there for 7.5 hours. They tried to get me to go to pee. I could not urinate. I had my surgery. They started at 9. My mom said they came out by like 10:15, saying that I was awake, I was being moved. So I went almost 12 hours, well, longer than that, because I peed at like 6:30 in the morning. I did not end up peeing until 11:45 at night, which they say is really common after surgery. I was not cathed. So they say it's common after surgery because anesthesia relaxes your muscles so much to where you kind of just don't have the urgency. Your muscles just don't really work right away. So the first thing I said when I got up to my room is, "You're not cathing me. You guys had the chance while I was asleep. I am not having a cath awake. Like, you guys are nuts." And the male nurse looked at me and was like, "Man, that's like the last step." He's like, "There's many other things that we do before we cath people." I said, "Okay, good, because even if it gets to that point, you're not doing it." I am the worst patient ever. So I got up there. It was around shift change. I got my first nurse who started out good. I had a really bad nursing experience at my hospital. They just were not attentive to a med surge patient, which is the floor I was on. It's everyone who's just came out of surgery and is recovering. So when I'd press my nurse call button to ask if I was due for pain medication, like, it would always take like 20 minutes. And at one point, Thursday morning, it was like 4:20 in the morning, and I was in excruciating. I was at a 10 out of 10, maybe even more. My nurse's assistant, which she was awesome, by the way. Her name, I think, was Lakeisha. She was great. I had pressed my button and she came in and she was like, "Ma'am, what can I do for you?" I was like, "I am in a lot of pain. Like, can you get my nurse to see like if I'm due for my pain meds yet or not?" So she said, "Okay, I'll go get her." So she turned off the call button. She goes, tells my nurse, and 15 minutes go by, and I guess I'm next to have my vitals checked. So she comes in, she's like, "So did the nurse come in yet?" And I'm like, "No." I said, "And I'm in so much pain. Like, I don't even want to talk. Like, I'm in so much pain." And that's how I know it's bad, because I talk no matter what. So she said, "Press your call button again. I'm staying here and taking your vitals. She will have no choice but to come." Fast forward 10 minutes later, I'm now at 25 minutes since I pressed my call button the first time, and my nurse comes in. How can I help you? Really? It is 4 o'clock in the mother freaking morning. Why didn't you come within the first 5 minutes? I said, I just need my pain meds. I said, am I due yet? She's like, yeah, I'll be right back. Another 10 minutes to go get a syringe full of Dilaudid to push through my goddamn IV. Pissed. So a whole bunch of doctors come in that day. My surgical team, residents, they all come in, check my incisions, ask me how my pain is, ask me how I'm doing with my water intake. And at this point, I'm doing really well with water. I tolerated cold water better than room temp water, which the nurses, as soon as I got up there, I was like, can I have some ice chips? And they're like, you're not allowed to have ice chips. And I was like, they gave them to me in the PACU, and I'm not throwing them up, or my stomach doesn't hurt. So what's the problem? So they contacted my surgeon team and felt like big idiots when they were like, yeah, she can have anything she wants as long as it's liquid and she's tolerating it. Give her whatever she wants. So in the hospital, I really just drank. The Jello that they gave me was freaking disgusting. It was protein Jello, which they sell at Walmart, like a case of 36 of them for $76. It was so freaking sweet. It was absolutely nauseating. It's like pro gelatin or whatever it's called. It was freaking gross. So I tried the chicken broth. The chicken broth was plain and disgusting. So I really didn't eat much of that. I legitimately just drank. I just drank water, and that's it. So my pain was pretty uncontrollable in the hospital. The Dilaudid did it. I would be awake for 10 minutes. They'd give me Dilaudid. I'd be out until I was due for more. So they really were urging me to stay another night. But I had major issues. I ended up with IV infiltration in this arm, which is where I had my IV, which means that the needle, the IV probe, was through the other side of my vein that they had stuck me in. And whatever they were pushing through my IV, the fluids that were hanging, they treated me with a bag of Keflex, which is an antibiotic to prevent any post-op infection. And anything else, I don't remember what else. Those are the two main things that I remember that were hanging from my IV pole. All that was settling in the surrounding tissue and was causing my hand to be so swollen. I mean, I couldn't even make a fist. That's how swollen my arm was. And at this point, it was shift change, and I had a new nurse, which she was more incompetent than the first nurse. So my mom was like, you guys aren't really concerned about, like, her arm? Like, her arm is so swollen. So she was like, okay, like, I'll change the IV site. So she tried in this arm, which pre-op had already tried in this arm, and they couldn't find it. So I let her know beforehand, I'm a hard stick. Like, it's going to be rough. She's like, let me try your hands. I said, my hand vein's blown. Like, I'm already severely bruised. Like, they're blown. Don't even try there. It's a waste of time. So she tried to stick me. She's like, all right, I feel it. She entered. She got a blood return, pushed, got resistance. Vein gone. So she starts huffing and puffing, rolling her eyes. Really, really severely unprofessional. And I, at this point, was so annoyed because I'm like, you're a freaking nurse. Like, I just don't understand how you have zero bedside manner. Like, you're in a profession where you have to be selfless and care more about somebody else and try to make patients comfortable. And you're annoying the hell out of me. So she's like, I'm gonna have to call the ED. They're gonna have to stick you. Okay, call the ED. So at this point, I was still unsure if I wanted to go home or not. I was really nervous about going home and being in so much pain. So we came up with a plan that said, okay, they're going to send me home with 2 milligram Dilaudid. Let's try taking an oral pill besides being, pumped through IV and see how I tolerate it. If I didn't throw it up, I had already in my head that I'm going home. I'm not staying another night in this hospital, having the first nurse that I had not. I don't even want the nurse's assistant, the second one, because she took my blood pressure 5 times in one arm and got a high reading. I'm sorry, do I have to tell you how to do your job too? Like, no, you don't do that because you're going to get a high reading. I'm on pain meds. My blood pressure is not going to be that high, especially right after I just got pain meds and it's already kicked in. She's another story. So, ED comes up. They get me in the right arm. 20 minutes after they switch my IV, I get discharged. All that for nothing. 0! And then this nurse was still being such a jerk to me. Now, the president of the hospital, I run his patients 1 day a week. We have a pretty good relationship. So all I did was name drop. And I get, oh my God, honey, I'm so excited for you. Congratulations. You're going to do so awesome. Really? Because I know the president of the hospital you work for, you're now going to be the nurse you should have been when you walked in at 7 o'clock this morning. Mind you, it was 6:30 at night, so I waited 11 and a half hours to name drop because no, I'm not going to get treated like royalty because I know the president. You're going to treat me like royalty because every patient deserves to be treated like that regardless of who they know. So I got discharged. I came home. I laid in bed and they say within 5 minutes I was out. Nothing is better than sleeping in your own bed. The first couple days were rough. In the hospital was rough. At home it was rough, just getting used to everything and making sure I get my fluids in, keeping my pain controlled. At that point, I was taking my pain meds every 4 hours. So Friday, I took my pain meds every 4 hours. Saturday, I took them sparingly. That Saturday night, I took my last dose of pain medication. So come this Sunday, I'll be 2 weeks without pain meds. And 2 Sundays ago, I felt awesome. I felt like I could freaking conquer the world. I tried to go out and walk Walmart. And my energy was it was not there. I hadn't been eating solid food, so I was really, really just tired and exhausted. So the first week out was good. It got better day by day. I started to be able a couple days after surgery. I think it was probably Sunday or Monday after surgery. I was able to actually sit on my side, rest on my side. My left side was way more comfortable because majority of the work was done on my right side of my abdomen. So I was laying on my left side. I started sleeping like that, which was awesome because I'm not a back sleeper at all by any means. I ended up catching or having contact dermatitis, which is just irritation of the skin. It's really common. My PCP says post-op. I'm allergic to sulfa, so the betadine they cleaned me with could just not have agreed with my body at all. And I had that binder on, like I said, for 3 days, and I didn't shower until I felt comfortable enough to stand on my own. So that was that. That was so freaking annoying. My IV infiltration went away by Saturday. My arm was hot, red, swollen. I was ice packing it like no tomorrow. The contact dermatitis actually just went away. I went to my primary care last Friday, and it was pretty much gone. I thought I was allergic to the Dilaudid, but after 48 hours of stopping that medication, I still had the rash. So I determined that it wasn't the medication. It had to be contact dermatitis, which, whatever, no big deal. So fast forward to full liquid stage, which I was allowed to have cream soups. So cream soups, they say, refers to the consistency and not the use of milk. But one can only take so much chicken broth and beef broth and Jello, which became something that I liked to eat because I was chewing at least. So I got addicted to broccoli cheddar soup from Panera. I got it from ShopRite it's like a tub container. And I pureed that so there wasn't chunks of broccoli. And I was measuring out half a cup of the soup at a time for a serving. And that was going down extremely well. I was getting my protein in. I was drinking 1 protein shake a day. I still am. And I was getting my water in. I was using Crystal Light to flavor my water. So things were going really well. Almost too well. Like, I was like, something's bound to happen. Like, what, am I going to throw up? Like, when am I going to start having, like, all these effects that people say they have after surgery? Like, I've had such a pleasant post-surgical experience aside from the IV infiltration and the contact dermatitis. Eating-wise, I've had 0 issues. This past Sunday, I got a little froggy and tried a meatball. It took me a half hour to eat a meatball, probably about this big, but I was so freaking excited. It didn't make my stomach hurt. I was hype. I was doing so well on liquids at this point. I felt like I could test my stomach a little bit. I wanted to see how I was doing and really consuming foods on a next level that I'm allowed to have really was going to tell me if I was healing right and if I could progress. So the fact that I handled that, I was like, awesome. When I see my surgeon on Tuesday, like, I'm going to ask him if I can move to my pureed food stage because I'm not due for that till Christmas Eve. And I am bored of these full freaking liquids. Like, I'm so tired of eating the same thing every day. Like, I need to switch up. So I saw my surgeon on Tuesday for my 2-week follow-up, which I have lost 28 pounds since a month ago today. Well, today's December 21st, but I'm not uploading this video until tomorrow. So 28 pounds, 14 of that since surgery. So he was like, your incisions look great. You're doing really well with your protein, your fluid. Like, you look great. How are you feeling elsewise? So I told him, and I was like, I'm really nervous about going back to work and not being on the next food stage. Like, I'm really concerned about my stamina and I don't want to pass out because, you know, when I'm walking around stores and stuff like that, I'm really tired. Like, I can't walk around Walmart without having to stop and sit somewhere because I get so spacey feeling in my head. Like, I feel like I could pass out. So he successfully moved me to pureed stage, and I was like, yes, because I had a half egg last night. So I didn't tell him about the meatball because I probably would have gotten in trouble for that. But I did tell him about the egg, and he was really happy that I tolerated a scrambled egg. So he moved me on to that, which now I'm eating egg salad, chicken salad. I haven't made the tuna yet. I'm iffy about the seafood. I am allowed to have shrimps, scallops. So we'll see. I don't know. But I'm hype about the meatballs because they were bomb. They were so good. So that's been my preoperative diet, my surgery day experience, my 2-week kind of how I'm doing. I said I was going to read clips from the mental journal I've been keeping, but it basically just says, like, I'm so excited to be, like, happy and healthy and to really, like, get my life back. Like, my main goal is to be healthy. Like, we want to start a family soon, and I just want to have, like, a healthy, normal pregnancy. And I knew at the rate I was going, like, the risk and the percentage of me possibly getting gestational diabetes was so high. And I want to be healthy. Like, I want to carry a healthy pregnancy. I want to physically be healthy within my own body. And I, more importantly, just want to be overall like 100% happy with where I am in it. And I knew that this was the only way. This is the only thing I haven't tried to get healthy. So I knew that I had to do this for myself. I had to do this for, my marriage, just to make it better. And, it'll make me want to go out more and be in public. Like, I've been such a homebody, like, the last 4 years. Like, we don't do anything. We don't go anywhere. Very seldomly do we go out. Like, we're not big partiers to begin with, but, like, I'd always struggle, like, what to wear, and, like, I didn't feel like I looked good. So I became, honestly, like, a super homebody, and that's put stress on, our relationship, because I don't want to go out. I don't want to do anything. I'd rather sit at home, in my sports bra and leggings than to get dressed up and go out and just not feel comfortable in the jeans I'm wearing or the shirt I'm wearing, worrying about what fat roll is hanging out now. Like, I didn't have time to want to worry about that. I'd rather had just stayed home, and that's what I did. So I'm super excited that I'm almost 30 pounds down, and it's showing. Some of the shirts that I used to wear that I couldn't wear anymore, I'm wearing again, and it's so awesome. Like, it's so great to fit into those things again. It feels so good. I love the way I'm starting to look. My goal is by my birthday, which is April. I have 4 months, and I really, really want to be 200 pounds or less. Like, that's my goal. I have 63 pounds to accomplish that goal. And once these New Year's resolutioners get out of the gym, I'll be able to go unbothered to the gym and start crushing goals. So thanks for watching. I know this video is a little longer. I've covered 3 separate entities. But thanks for watching, and come back soon for an update. The next video may be the Q&A with the hubs on how it is for spouses to go through weight loss surgery and them not be operated on. Thanks, guys.